Hey, good afternoon, everybody. Dr. Alex Callio, Comfort Family Chiropractic here in Lincoln, Nebraska. I'm going to talk to you today about lower back pain. And we want to introduce this out to everybody, kind of a new format we're going to be doing starting this month, kind of a condition of the month. So we're going to introduce low back pain to start with today. Of course, most people, when they think of chiropractic care, think of back issues. So it kind of seemed the most prominent one to start with here. But it's estimated probably 80-85% of the population at any given time is going to suffer with lower back pain. So chances are this is you. Probably a lot of people that you know as well. So it seemed like a good place to start with this. So we're going to talk about some of the causes of lower back pain here today. And then each week over the rest of this month, we're going to talk about different treatments for some of the different causes of lower back pain. So we hope to see you join us. You know somebody that suffers with low back issues, tag them in this post, hit that like button, share this out there. We want to get this information out to as many people as we can. So definitely make sure we share this out and join us in the coming weeks to kind of see how we go about treating some of these things too. So you can see kind of from the image behind me here, we have a view of low back pelvic structure here, and we'll dive into in a minute. But really there's four causes of lower back issues, really from muscle to joint, disc, and nerve. And really, as we go through that hierarchy, the complexity of the issue and the severity of the issue certainly go up. So many cases we'll have just a muscular issue. We think of maybe, we sat too long somewhere, muscle feels tight, feels a little achy, but not really pain. Maybe you got a small sprain strain injury, although again, probably starts to involve some of the other things than just the muscle. But a muscular issue by itself, probably one of the easier things to work to take care of. But as we go down that ladder, if we start to involve the joint in this as well, which many times there will start to affect range of motion, feel more restricted in our movement, inability to bend or move, that kind of thing. So typically as we go down, if we now involve joint, we're going to typically also have muscle involved. So that can mean both in terms of a little more complex on the treatment side, may take a little bit longer to settle than just a muscular issue, and start to involve things beyond just either muscle work, massage, stretching, some of those kind of things. And pain levels then start to go up more. As joints compress, it typically will cause certainly pain. You're going to cause more restriction, and that can come from a lot of things. Arthritis can come from injury, especially we think of like slip and falls, whiplash injuries, those kind of things will create compression at the joint surfaces and inflammation and restriction. And so that will lead to pain, tightening of tissue around it, some compensation from your body. So we start to get joint and muscle involved. There again, pain levels go up, complexity of the issue goes up, and some of the treatment things start to change. Now, of course, if we go down that rung again and start to involve the disc, which as we look here, in between we have the actual bony structure here, the disc that sits in the middle, and that's that kind of gel cushion in between our spinal bones that both allows for spacing for the nerve tissue, for the spinal cord, but also then allows for shock absorption. So really important spacer there of the spine that, think of it kind of like a balloon, as you start to put pressure on a disc, if we're getting compression, if we have an injury, a fall, those kind of things, you compress that disc, much like that balloon, it's going to push or out pocket somewhere. So if we get a little tear in the outer part of the disc that holds that gel in, it's going to bulge. Basically, when we, again, think of a bulging disc, picture that balloon. We start to pressure it, that air has to go out, it's going to out pocket and bulge out. That can push into either just cause pain by itself, or potentially involve the nerve tissue as well. But many times that disc pressure pain will just be that from the disc itself. And of course, if that pressure increases too much like that balloon, it can burst, and that's what a herniated or a slit disc is. Not fun stuff that we want to have going on, but if we start to have disc involvement, you will almost always have joint and muscle involvement with that too. So again, that rung of complexity, pain, treatment side kind of goes up again if we start to involve that. And many times with the disc, if it is bulging or herniation, you're certainly pushing into nerve tissue. But as we get down to the nerve, you can have that come from pressure from the disc. It can come from a misalignment or rotation, tilt of the spine that's causing narrowing of the nerve opening. You can have inflammation that can irritate the nerve tissue. But anytime nerve gets involved, that's always the most complex one to really start to treat. And that is typically seen with, radiating pain or numbness down into the legs, thighs, buttocks area there where we get the nerve tissue inflamed or pressured and trapped, and that will cause some of those radiating issues as we get down past just the lower back area. So nerve then almost will always involve disc, joint, and muscle. Definitely the longest and the hardest portion of when it comes to back-related pain to treat. So, as we look at the hierarchy here, the initial part of any visit, initially seeing somebody with back issues, is determine which of those things are involved. Is it muscle? Is it joint? Is it disc? Is it nerve? And then applying appropriate measures from a treatment standpoint to treat all of those things. We can't just stretch the muscles if we have a joint or a disc issue. We've got to address that at that mechanical level too. So it's one of the reasons a lot of times when we have people with disc or nerve things that they come in and say, well, I've been stretching at home, I've been doing some of these things and it just hasn't gone away. It's because we can't just focus on the muscle if we have these underlying other things involved too. We've got to come at it from both approaches, and that's something that we certainly look to do here in the office. So really complex as we look at both anatomy and alignment through the pelvic structure, tailbone, spine, to kind of figure that out. And so many times that's why that initial visit will involve both a really good sit-down consult and exam, run through a lot of orthopedic neurologic tests, potentially even x-rays, in severe cases maybe even MRI, to get that diagnosis accurate so we know which of those things are involved, how many of those things are involved, to be able to get that right treatment applied. So certainly if any of these things sound like it's what's going on with you, get in touch with us. Certainly get a hold of us. We can get you in, get that looked at. Certainly, if this has been something going on a while, join us this next week. We're going to talk about some stretches and exercises that we can do to help with some baseline mechanical issues of lower back pain. So next week, we're going to talk some exercises from there, and then we're going to progress into some of the disc and nerve treatments as well as this month goes along. So we hope to see you next week. Join us again. We're going to talk some exercises for the back, and certainly if you have questions in between, get a hold of us. You can catch us online at our website, comfortlincoln.com. You can obviously find us here on Facebook as well, through Instagram. We're on all the social media channels, or you can just do it the old-fashioned way. Pick up the phone, give us a call, 402-484-5166. We hope to see you soon and keep you healthy and moving. Have a great rest of the day.